Welcome to the Time of Your Life with the Baltimore County Department of Aging. I'm your host, Ethel Rasmussen. As always, the Time of Your Life is about sharing resources for living your best life and dedicated to keeping you well informed about the programs and services that are especially designed for you. You can also connect with BCDA through our agency's multiple media platforms that include our website, Facebook, the Time of Your Life Digest, Flickr, Map, and our YouTube channel, as well as an abundance of printed resources. Connections to BCDA are stronger than ever, so please take advantage of the many options we offer. Today's show offers empowering information along with the option to enjoy additional opportunities to make a difference in the community through the holidays. Alison Vogrin, Volunteer Center Manager for the Baltimore County Volunteer Center, shares information about the new center. Stay tuned to learn about ways to connect with organizations in Baltimore County that need volunteers. We begin today's show with a popular and important topic, especially during this time of year. Yes, you've guessed it, Medicare Part D open enrollment and benefits. Let's start the show with Shelby Jones, manager of the State Health Insurance Assistance Program, known as SHIP. Shelby, welcome to today's show.
Thank you, Ethel. I'm so happy to be here with you all today.
Prior to starting our conversation about Medicare Part D, can you briefly share the responsibilities of BCDA's SHIP office?
You've got it. Absolutely. What we do is we help people navigate the Medicare process, any changes and any unique experiences that can arise along the way. As I'm sure you can imagine, changes happen throughout the year, so we like to make sure that we keep people and our constituents and residents not only in the know about potential changes, but we also make sure that all of our volunteer counselors remain highly trained and are also able to answer any questions that folks may have as they arise.
Shelby, SHIP provides an invaluable service to Medicare beneficiaries. Let's begin by talking about Medicare eligibility and enrollment. What are the basics that viewers should be aware of?
Absolutely. So the common misconception among most of us is that you become eligible for Medicare only by turning 65. But let's backtrack on that quite a bit. So in order to be eligible for Medicare, you must be 65 or older and receive or be eligible to receive Social Security benefits. You also need to have had your resident visa and have lived in the United States for 5 consecutive years. Okay, that's another piece of the puzzle. You can also qualify for Medicare when you are under the age of 65, which not everybody realizes. If you're someone who's been receiving Social Security disability benefits for 24 months, you become eligible for Medicare at the 25th month, and you will be automatically enrolled. Very important, right? To keep our eyes and ears open regarding those potential changes. Folks who also suffer from end-stage renal disease or ESRD or ALS, Lou Gehrig's disease, can also be eligible for Medicare.
So what are the different parts of Medicare? Can you provide information about each benefit and what that benefit covers?
That's a great question. We have Medicare A and Medicare B. Medicare A is everything inpatient. So that includes things like inpatient hospital stays, skilled nursing stays, as well as hospice care and home health care. Part B, that is our outpatient medical coverage. Think labs, x-rays, doctor's visits, right? Makes sense. As we get further and further down the line in the alphabet of Medicare, we reach things like Part C. This is Medicare Advantage, and I believe we're going to talk about that in a little bit more detail in just a bit. So I'll hold tight and just kind of put the plug that Part C and Medicare Advantage are the same thing. They are not two different things. Last but certainly not least is Medicare Part D. That's what all the hubbub is about right now during open enrollment, and that is your standalone prescription drug coverage. Number one question that we're getting this time of year is, hey, I don't take any prescriptions. Do I still need it? Absolutely. And we can talk about a little bit more about that later.
There are ads on TV mentioning Medicare Advantage programs that have a give back program and allude to Medicare Advantage plans having little or no copay. Can you address these topics for our viewers?
Absolutely. I'd be happy to. So with Medicare Advantage plans, what's happening is that there are a number of advertisements, exactly as you described, that are being produced to the masses. But unfortunately, the masses are not necessarily eligible for those benefits. What I mean by that is the Medicare Advantage plans specific to Baltimore County residents that offer things like flex cards that you might hear about, where you get additional monies that can be put towards utilities and food. Those are only available to Medicare beneficiaries who are on Medicare and Medicaid, or Medicare and QMB, which is the Qualified Medicare Beneficiary Program. If you're on QMB, you would have a gray and white paper card telling you so. If you are on Medicaid, full medical assistance, you would have a red and white paper card to tell you so as well. So if you know, you know. Unfortunately, though, again, these commercials that we see on TV advertising these extra benefits, which are fantastic benefits, are not necessarily available to all Medicare beneficiaries out there. However, if you do need more information about different Medicare Advantage plans that are offered to Baltimore County residents, please feel free to call the SHIP office. We have an updated list for all Medicare Advantage plans offered to Baltimore County residents in 2024. And I also just want to say that this year is the first year where there are more Medicare Advantage plans offered to Baltimore County residents than standalone prescription drug plans. And that really fits with what we're seeing as a society as a whole, where there is over 50% of Medicare beneficiaries are receiving their services through Medicare Advantage plans at this time. So the change is here.
What a great explanation. We're going to take a short break, but first, please consider subscribing to BCDA's newspaper or gifting it to someone now in its 45th year. The Digest is a newspaper filled with news, the latest government happenings, columns and articles from the county executive, county council, and other Baltimore County agencies. You'll learn about Medicare, nutrition, health-related subjects, travel, senior center programs, events, volunteer opportunities, and so much more. Subscription rates for Baltimore County residents are $5 annually. It is a true bargain. For more information about the Time of Your Life Digest, please visit the newspaper's website or call 410-887-3050. If you're a business owner, this is an opportunity to outreach to a target audience. We will return. We will learn more about Medicare Part D.
An official message from Medicare.
Let's give her a minute before we start. You know how she is.
Y'all check your Medicare plans? It's open enrollment.
No, why?
Because plans change each year. So can your health. Make sure you choose the right plan for you and your budget. You might save some money or get a few extras.
What I missed?
Open enrollment ends December 7th. Compare your prescription drug and health options at Medicare.gov. Paid for by the U.S. Department of Health and Human Services.
Welcome back to the Time of Your Life. I'm your host, Ethel Rasmussen. Let's continue our conversation about Medicare Part D with Shelby Jones, manager of the State Health Insurance Assistance Program known as SHIP. Shelby, welcome back.
Thanks so much for having me. Happy to be here.
For Medicare Part D, this prescription drug benefit has a designated open enrollment period from October 15th through December 7th. Can you talk about the importance of these dates?
I am so passionate about what we do in the SHIP office, but specifically during the open enrollment season. We meet with folks during the open enrollment season, as you mentioned, between October 15th and December 7th. This is your opportunity as a Medicare beneficiary to say, you know, my plan, my prescription drug plan has served me well this year, but is it going to serve me well in the new year? I talk with people frequently and I hear things like, oh, I like my plan. I like my plan. It's been good to me. But what happens if your plan doesn't like you in the new year? Prescriptions can change. Our health can change at any time. But this is your period of time. And I really tell folks that this is your time to exercise your right to make a change that could significantly benefit you financially. If your premium is going to go up and your medications aren't going to be covered, that's information that you deserve to know. And you deserve to change plans to make sure that you know exactly what you're getting into for the new year ahead.
What type of assistance is available to support Medicare beneficiaries with their research?
We head out as a team of volunteers to the different senior centers located across Baltimore County. We basically set up shop day after day, and we work on a one-on-one basis with beneficiaries or perhaps their caregivers on their behalf to make sure that we can say, yes, your plan is still the best, or, you might want to consider a change. And we can work through all of that information together. This season, we're also expanding our ability to offer phone appointments, which has been a very, very exciting offering. What we're doing is we are calling people at their designated time on their designated day from our main office for the State Health Insurance Assistance Program. And what we do is we do essentially the same thing that we're doing during our one-on-one appointments. We put your current prescription drug plan in the Medicare Plan Finder. We check your current prescriptions as you provide them to us to see if anything's not going to be covered or if coverage has changed. And what we also make a very important point to do during every single appointment is to ensure that we are reviewing for financial assistance eligibility. Because one thing that we hear constantly and we understand from these conversations is that prescription drugs are expensive, but they are necessary for our health. So if you were ever curious about doing a prescription drug review and you weren't really sure where to start, please call the SHIP office and I'll make sure everybody has all of our contact information at the end of the show so you'll know exactly how to reach us to either schedule an appointment, find out if you're eligible for financial assistance, or for any other Medicare questions.
Shelby, can you review with our viewers the information they need to know about Part D 2024 changes?
Absolutely. So from a numbers standpoint, the standard deductible this year in 2023 was $505. Next year, it's going up to $545. So you can start to see how certain things are changing. There are some Part D prescription drug plans that have actually been erased for 2024. So if any of our listeners out there are currently on an Elixir prescription drug plan, well, you might want to give us a call or call 1-800-Medicare to see about a change because your plan will not even exist next year. Medicare Part D premiums fluctuate. Some premiums go up, some premiums go down. This year in particular, we've had a lot of phone calls specific to the WellCare Value Script prescription drug plan. And please note, as I'm listing off plan names, I am not making any endorsement for any plans. The plan that we would recommend for you as an individual really is based on an individual basis and the medications that you take. But with WellCare Value Script, their premium this year was $10.10. Next year, it's going down to a whopping 40 cents a month. So for $4.80, you've got yourself a drug plan. But we've had a lot of calls about that and a lot of questions about that because people think it might be a typo, but it is certainly not a typo. We have done our due diligence to check all of that information. Another big change under the Inflation Reduction Act is that if you were to enter the donut hole and then exit the donut hole, hitting what's called catastrophic coverage, now out of pocket, you will be spending nothing out of pocket once you enter catastrophic coverage for your covered medications. Another change that comes to mind for 2024 is related specifically to the Social Security Extra Help Program. What it does is it helps keep premiums, deductibles, and co-payments of prescription drugs at little to no cost. And as we know, medications are expensive, so this is a very, very helpful program. This in 2023 was the last year where we would have two different types of extra help. Partial extra help and full extra help. Which one somebody was awarded was dependent upon their income and their assets. But in 2024, there will only be one whole extra help program. What that means is if you were to qualify for partial extra help, you will now be receiving the full extra help benefit. There's very minimal drug co-payments and again, little to no deductibles and premiums, which is huge. So that's a very, very exciting change. There are some additional changes, as I'm sure people have heard, being passed around that don't start until 2025. We've had some questions in our office about the drug price negotiation negotiations. People are getting very excited about that, which I can definitely understand if you're taking brand name medications. Just keep in mind, those aren't going to take effect until 2025, but it's always good to stay in the know.
You mentioned extra help. Can you share information about those benefits?
So again, with Extra Help being a federal financial assistance program, Social Security wants to know what is your income, and when they're talking income, they are talking gross income before anything comes out. The other thing that they want to know is assets, and we get a lot of questions in our office regarding what is an asset? What defines an asset? If you have one home and one vehicle, that's not going to count against you. Subsequent homes and vehicles are going to count. Social Security wants to know, do you have things like stocks, bonds, IRAs, pensions? Do you have, this is my personal favorite, and I can't direct quote it from the website, but it's something along the lines of, do you have money anywhere else in your house? So I usually joke and say hiding in shoeboxes under your bed. But do you have any other money, sources of income anywhere? That's what Social Security needs to know. And then what they do is they review that information. And to apply, by the way, I will say you can either call Social Security over the phone, and you can apply over the phone with a Social Security Administration rep. Or you can also go online to ssa.gov, which is the Social Security Administration website, to file your application online. Once your application is processed, you will be awarded. Now it's just going to be extra help. There is no full or partial, as I mentioned, this change coming in 2024. What it does is it helps to keep your drug costs low. Co-payments are typically around, I want to say in 2024, for generic drugs, they're capped at $4.20 and around $11 for brand name medications, if I am not mistaken those numbers. But it should be around $4 and $11. So again, $4 for generics, $11 for brand. And typically you have little to no monthly premium and little to no deductible if there is one. But it's a really fantastic program as well that's out there for people to really help make sure that your prescriptions can remain affordable.
And there is also an additional program called SPDAP. Is that true?
This is true. What SPDAP stands for, it's SPDAP, Senior Prescription Drug Assistance Program. What this program does, or who it's for, I'll start with, is for folks who have been a resident of Maryland for at least 6 months, and for folks who meet the income criteria. Right now, I believe the income is around it's a $43,000 cap for a single individual and around a $59,000 cap for a married couple. They do not look at assets. So if your income meets the guidelines, but you were concerned about any assets that you might have, you don't have to worry about that because they're not factored into the equation to determine eligibility. The state currently in 2023 provides up to $60 per month towards your prescription drug plan premium. And in 2024, it's going up to $75 per month, which is fantastic. And the other thing I will add specific to the Senior Prescription Drug Assistance Program is if you are accepted into the program, you can change your Part D prescription drug plan one time outside of open enrollment. What a nice opportunity to have if your drug plans, if your drugs change, when you go to see your doctor, let's say in April. Do you want to have to wait until open enrollment and not have any change take effect until January 1st? Or do you want to be able to make that change in March or April whenever you go see your doctor and have it start the first of the next month? What a great opportunity to have.
Great point, Shelby. How can viewers get in touch with the SHIP office?
You can call the SHIP office at 410-887-2059. Please leave us a voicemail and we will return your call as soon as possible. We have a dedicated team of amazing, highly trained volunteers who are more than happy to assist. But just make sure you leave your information in the voicemail so we can return your call as soon as possible. We also have an email address that you can access us. You can email us at Medicare information at Baltimore www.countymd.gov. Please send us any referrals. We are more than happy to help you with any of your Medicare related questions, whether it's during the busy season of open enrollment or in the new year if maybe you're going to be new to Medicare this year. We'd love to help.
In closing, do you have any final thoughts you'd like to share with our viewers?
I just want to say thank you to the Baltimore County Department of Aging for all that they do, for getting this information out there for all of our viewers and all of our residents. And I also just want to make sure that everybody knows we really are here to help you. We're here to provide unbiased information. We are not insurance agents looking for a commission. We are just here because we want to be and because we want to help you.
Thank you for making time in your busy schedule to share information and support to Medicare beneficiaries in Baltimore County, Shelby.
Thank you.
We're going to take a short break, but first I'd like to share exciting news about our Caregiver Conference happening on November 17th. Please call 410-887-4724 to register or learn more about the support services the Caregiver Program offers. When we return, we'll learn about the new Volunteer Center in Baltimore County.
Flu can be serious for everyone, but for adults age 65 years and older, the risk of serious complications is high. Immune systems weaken with age, making it harder to fight disease. The good news is there are specifically designed influenza vaccines available to help protect older adults against flu. Talk to patients age 65 and older about the importance of annual flu vaccination and specific vaccines most beneficial for them. Care for older adults? Care about flu.
Welcome back to the Time of Your Life. I'm your host, Ethel Rasmussen. This segment is special since we are talking about the new Baltimore County Volunteer Center. Joining us today is Alison Vogrin, manager at the Baltimore County Volunteer Center. Welcome to the show, Alison.
Thanks, Ethel.
What is the mission of the new Volunteer Center and why has it been established?
So in simplest terms, the Volunteer Center's mission is to promote volunteerism in the community, and we're using a two-pronged approach. So first, we're working and networking with government agencies as well as nonprofits in the greater Baltimore region to spotlight their volunteer needs and have more visibility for them in the community. The second approach there is to work with community members of all ages to connect them with these opportunities so that they can engage in meaningful opportunities. So we're essentially a clearinghouse that's working with volunteers for all reasons, whether it needs to be for court-appointed hours, student service learning hours, or just because they want to volunteer. So we're like a one-stop shop where we can help link them with these agencies and make these partnerships happen. So it was established because at one point the county did have an active volunteer center, but over the years as priorities changed, so did funding. So under this current administration, the county executive has decided that he wants to once again make volunteerism a priority, and so has fully supported the launch of this new volunteer center.
So what are some of the features of the Volunteer Center?
So one of our primary features is our Get Connected volunteer portal. This is an online search engine where agencies can post their needs and volunteers can connect with them in real time. So volunteers can go on, see what an agency has available, and respond to them 24/7. And they can search for these opportunities, whether it be by location, by availability, area of interest. They can even, to a granular level, search for opportunities that are family friendly or maybe wheelchair accessible. So agencies have the options of indicating these to help narrow down the search for volunteers. So it's very user friendly tool that like I said, connects people in real time. There are so many nonprofits out there that to find them and just do a basic Google search, you wouldn't even cover all of them. So here, as I had mentioned earlier, it's a one-stop shop. So we can highlight those opportunities you may never have even heard of. In fact, I have 15 years of volunteer management experience and an active volunteer myself, and I'm finding out about agencies I've never even heard of through this. So.
Now that you've piqued our interest, can you give us some examples of volunteer opportunities that are available in the community?
So there's ongoing opportunities as well as one-time opportunities. So for instance, for an ongoing one, we work with court-appointed special advocates of Baltimore County, and they are looking for volunteers to be a central person in the life of a foster child. So they're working with school counselors, teachers, foster parents, anybody that's tied to this child to make sure that they're receiving the services that they need. And in Baltimore County, there are about 600 children in the foster care system and not enough CASA volunteers to represent them all. Then on the opposite end, if you're looking for something that is more on an as needed basis, we work with Happy Helpers for the Homeless, and they serve people who are low income throughout the county, and they give them necessities and food once a week, year round. They have volunteers that are making and preparing the food, as well as volunteers that are out literally walking the streets distributing the items. So that's an opportunity, and they always have something going on. They fill our calendar. And then another opportunity that we have that's new to me is the Goucher Prison Education Partnership. And they have tutors that are going and working with individuals who are incarcerated to help tutor them in English and math and actually in other languages as well. So there's more than 40 agencies right now who are posting on our portal, but we anticipate this number to grow as we continue to network. And so we encourage people to continuously check the portal.
That's exciting. Why is volunteerism so important?
So from a larger societal viewpoint, volunteerism is critical to addressing all the needs in the community. And if you think about it, volunteers build capacity. And by that, I mean, they're filling in the gaps of when there's limited resources and staffing with agencies and different organizations that are trying to address these challenges. And so they help spread the mission of the agency. And one example I can think of, you were just talking with Shelby. So she's talking about Medicare Part D. She's one person serving the whole county. So without her, I think she has nearly 20 volunteers helping to do the counseling there. She could not reach that many people or this amount of people that they have. So from that viewpoint, volunteers are critical to everyday actions and everything we need happening in society. But volunteerism is also important because it has a host of health benefits and provides people with purpose. And I know one of the areas I've been most concentrated on prior to this was working with people who have recently retired or who are retired, and having that something to retire to a meaningful service to do is important. So all around, volunteerism has a lot of benefits and is important to the larger society and to the individual.
So how can people learn more about the Volunteer Center?
So probably the easiest way is to Google us, Baltimore County Volunteer Center. We have a site on the county government website, and we have there a link to all of the internal county government volunteer opportunities and a link to our agency portal. But you can also reach us at volunteers@baltimorecountymd.gov by email, or you can call us directly at 410-887-2715. And it's myself and Michael Grafton. He is a AmeriCorps member who's helping us in the interim to build this volunteer center, and we would love to talk with people about opportunities or even to talk with agencies about how they can better promote themselves.
Thank you, Alison, for taking time to share information about how individuals can make a difference during the holiday season.
And thank you for giving us this opportunity to share this exciting new initiative.
That's today's show. Thank you for spending your time with us. Please remember you can call the Department of Aging's information line called Maryland Access Point of Baltimore County, or MAP, at 410-887-2594 with questions pertaining to older adults or persons with disabilities. This show may also be viewed anytime on the internet at www.baltimorecountymd.gov/videos with open captioning. On behalf of the Baltimore County Department of Aging, we wish you a very happy holiday season with health and happiness in the new year. That brings us to the conclusion of this edition of The Time of Your Life, a National Mature Media Award winner, about the services and contemporary topics that keep you in the know. Until next time.